Hello and welcome to the September 2022 edition of the Collaboration Cafe webinar, sponsored by the Midwest Big Data Innovation Hub with support from NSF. I'm John MacMullen, Executive Director of the Midwest Hub, and today we'll be looking briefly at two solicitations, one from the National Institutes of Health and one from the Agency for Healthcare Research and Quality, or AHRQ, both of which are units of the U.S. Department of Health and Human Services, and so there are substantial similarities between these two programs. They're both designed to support workshops, conferences, and other kinds of scientific meetings. And we'll be looking at those today to get a sense of what would be a good fit for our community to engage around data and health and resilient communities. But hopefully this information will be helpful to other folks who are looking to develop scientific meetings in a health context. So for those who are not familiar with the Midwest Big Data Innovation Hub, we are part of a national network of 4 regional innovation hubs funded by NSF for the past few years. We are focused on a 12-state area in the Midwest, but we have that national footprint and engagement with the other hubs as well. Today, our focus really is on looking at programs that are relevant to 2 of our priority theme areas, big data in health being one and smart and resilient communities being the other, and thinking about ways that we can help to develop the communities that are interested in data across those areas. Just very quickly, this Collaboration Cafe webinar series is designed to help to build collaborations across institutions in the Midwest and help folks develop their network of collaborators and partners across academia, as well as industry, government, and nonprofits. So we have this regular venue for folks to engage around data science topics within particular community segments. So we have our webinar, but we also have a website and Slack community and other resources available for folks to participate offline as well. The Midwest Hub does engage with the community in different ways on proposals. In some cases, we lead those directly. In others, we partner to help with outreach and amplification of project activities. And we also can take larger roles as funded partners to help develop programmatic activities that involve outreach and communication and events. So keep us in mind if you have upcoming opportunities where you need those types of services. We'd be happy to talk with you about helping to develop that work with your community. All right, so let's talk first today about the NIH Support for Conferences and Scientific Meetings program. This is classified as an R13 program, and we have the link to the funding opportunity announcement here in the slides. These slides will be available on our website after the meeting today. This is a regular program that has been around for many years at NIH, and so they have regular due dates for proposals. The next 2 coming up would be in December of 2022 and April of 2023, if folks are looking for the timeline to work into for those. But 3 times a year, there are due dates for this particular program. One unique thing to note about this program, in comparison with NSF, for example, National Science Foundation, which accepts workshop proposals at any time throughout the year and without any letter of intent or permission. In the case of NIH, you do need to request permission from one of the NIH institutes that is, something that's close to your topic for your meeting, and reach out to that institute and request a letter from them that gives you explicit permission to submit to this solicitation. So that's a really important step. You need to have some lead time in order to do that. They are requesting at least 6 weeks in advance of the proposal due date. So if you were to submit in December, for example, you would have to reach out to them and get that permission letter sometime in November. So you definitely want to keep that in mind, and they do have a nice web page with all of the contact names at the different institutes and discussion of the focus areas for their institutes to help you identify which is the most appropriate for your topic. Couple of other elements that we're starting to see pretty often in federal agency proposals. In this particular case, NIH is looking for a diversity plan specifically designed to bring in populations underrepresented historically in sciences, and also with NIH funding, folks who have not received a lot of NIH funding previously. So that's really important. That's a significant part of the proposal narrative. NIH also requires development of a safety plan for the actual meeting event to mitigate discrimination and harassment and other situations. And so they provide some useful background to work with there, but that really is a responsibility of the conference organizers to develop that plan specifically in relation to your proposed activities and include that in the proposal. They do have a full page of detail about this particular program, as well as an FAQ document. And so we're linking to those here for you to give you all of the details about eligibility, what kinds of costs are allowed to this program, what kinds of reporting do you have to do after the project ends. Lots of other details provided there. So very helpful information from them. Definitely encourage you to check that out in detail if you are developing a program for this, this proposal stream. Here are the elements at the bottom of the slide here that are mandatory for each of these proposals. And so the permission to submit letter that I mentioned previously gives you that entry ticket to the program. The budget included is a non-modular budget. So those of you who have submitted NIH proposals before know that they have a specific budget process. This is does not follow that modular budget process. This is a different approach. So again, you really need to explore the requirements there and make sure that you're conforming to those for your budget. The conference plan is sort of like the research plan that you would see in a research proposal, but really focused on what exactly is the meeting about, who's the participant you're expecting to be there, what are the goals of the meeting, what kinds of outcomes and outputs are you planning on, really giving a lot of detail about specifically what your aims are for this meeting and why that is significant to your community. We talked about the diversity plan and the safety plan. The other key element here is understanding who the leads for this project are, the project director or the PI. What is that person's experience with this topic area and with running meetings previously to give the reviewers a sense of the readiness of the team for this project. All right, so that's what you need to include in your proposal. Let's talk about how NIH is reviewing these proposals. All the details for these review criteria are in section 5 of the funding opportunity announcement, and that is linked here from this slide. But you know, at the top level, they're interested in what is the substantial impact that this activity will have on the goals that NIH is supporting. So each of the institutes, as we talked about, has their own goals. You want to be tied into that particular level of their strategy, but then, beyond that, being explicit in your proposal about the potential impact of this activity is really important at the top level. There's also a number of criteria that are scored numerically by the review team. So each of the reviewers on the panel will assign a numeric value to each of these criteria. Again, there's more detail about what these terms mean to NIH in the FOA itself, but what's the significance of this activity specifically, as we talked about? How suitable is the proposing team to carry out the activity? What's new about this? What's innovative about the work that is going to help move that area of the field forward? What particular approach are you taking within the meeting? And what's sort of the environment that meeting is taking place? So, for example, is this an in-person meeting? And if so, what is the venue for that? What's the significance of holding it in that particular place? If this is an online or hybrid meeting, both of which are encouraged by NIH, talking about how you're addressing the challenges of working within that kind of framework, I think is important here as well. Beyond those scored criteria, there are other criteria that the panelists will be looking at and considering. We talked about the diversity plan earlier, having specific details for in-person meetings about family and child care facilities and accommodations is an important part of the plan there as well. And then the panelists will be looking at the budget to make sure that they feel that it's appropriate for the scope of work that is being proposed. So that is a quick snapshot of the NIH proposal program. Let's switch to the AHRQ model. I think you'll see, particularly in the review section, substantial similarity to the NIH program, but we'll see some differences here in the solicitation. This being part of DHHS, this does follow the typical NIH proposal model and mechanisms, and so the due dates are the same. They're the 12th of December and of April next year, and the submission process is substantially the same through ERA Commons as well. In AHRQ's case, they are very focused on health outcomes and health services research, and so they have 4 categories of meeting types that are supported through this program, and you as the proposer need to designate one of those as being your core focus. Again, in the solicitation, you'll see a discussion of what these terms mean, but so it really depends upon your focus in terms of whether this is a research-oriented conference. Is this more about community engagement and dissemination? Is it about training? Really getting a sense of your core focus and selecting one of these is really important. We have some language here about the mission for AHRQ and what exactly they're trying to support through this mechanism. In particular, they are supporting dissemination of findings and best practices beyond the attendees of the meeting. They would really like to see a plan for how you are broadening out the outcomes of the meeting to a larger population of researchers, practitioners, whoever is relevant to that content. They have given us some guidance about which costs are allowable for your meeting with a cap of $50,000 annually for this program. That does not include indirect costs or F&A, facilities and administrative costs. Other agencies do allow those costs. For example, NSF for their workshop program does allow F&A costs. And so that's something to be mindful of, because your institution may have restrictions or policies around proposing to programs that do not allow F&A. So definitely want to keep that in mind and talk with your sponsored program office about the implications of that. For other costs, they give you some specific examples like speaker fees are allowable. And so if you're bringing in guest speakers who have a certain level of expertise in some area, you are able to provide support and fees for them, but honoraria, for example, are not allowed in this program. So again, thinking through exactly what your costs will be in terms of participants is important here. Likewise, food costs with a meeting, which are often substantial in terms of the percentage of a meeting, those are not allowed for this. And so if you expect to have food for your participants, you need to make sure that you have another source of support for that, since it's not allowed in this particular program. Same thing with meeting-related promotional items. So swag bags and other giveaway items are not allowed for support under this program. The good news is that consultant fees and salary support for administrative support staff are allowed under this program. And so support for audiovisual services, for captioning, interpretation, outreach and communications, those kinds of things are supported. And so that's a great way to help to run and advertise and support the activity by writing in support for salaries for those folks. So looking at the proposal elements, again, we have a project description. In this case, it's called a research strategy. You have a brief project summary at the front end. Again, some context about who the PIs and the project team are here. Your budget, which again is the NIH non-modular format. And in this case, they are looking for a data management plan to understand what happens with the outputs from the meeting. Could be recordings, could be documents that are produced, slides, white papers, other kinds of outputs. Where do those live after the meeting? Who has access to them? How are they disseminated? Things like that are important to include there as well. All right, so let's look at the review criteria for AHRQ. As I said, it's very similar to the NIH program. They're interested in the overall impact of this activity in relation, in this case, to AHRQ's mission rather than the NIH Institutes. But again, that high level sort of the broader impacts, if we use NSF language here for a minute, what's the broader sustained impact of this activity going forward that you expect to see as an outcome? In this case, they do have scored review criteria that the panelists will be using, just like NIH, and a lot of those are very similar. So again, the significance, the investigator's suitability, what's the new innovation, what's the specific approach that is being taken, and what that environment looks like. Those are all exactly the same as the NIH program. Additional criteria that the panelists are considering include are the priority populations that AHRQ has, and those are specified in the solicitation. Are those populations being actively included in both attendance at the meeting, but also planning and participation in the governance of the meeting? What's the specific plan to address inclusion of those populations in your event? Again, the budget is important to have them understand exactly what costs you are trying to cover here. If you have other support that is helping to pay for the costs of the event, you can mention that as well, but the specific budget details cover, the costs that we talked about previously. And then they have a category called degree of responsiveness. And so again, this is sort of like the overall impact in the sense that it is a more qualitative interpretation of what this project is responding to and supporting within your community. All right, so that is a quick rundown of those two programs. As you can see, there's a lot of similarity there, and you can probably transfer your experience from one program to the other, particularly if you have proposed to NIH before. It is different in a lot of ways from NSF, and so being mindful of what those differences are and how you may have to adapt existing content that you may have developed for other agencies in proposing prior workshops is, I think, important to look at. And again, there's a lot of details in the solicitation about what those differences are. All right, before we close today, since the topic of the meeting this month was data and resiliency around health, I wanted to mention that the Midwest Big Data Innovation Hub has had quite a bit of activity in these spaces previously. In the past 5 or 6 years, we've had a number of events and other activities to really try to catalyze the communities in these spaces. And we really want to continue that going forward with resilient communities as a core part of the work that we do. And so we've had a couple of sessions on this particular webinar series earlier this year, looking at data science in health through a joint NSF-NIH program, as well as the NSF Smart and Connected Communities program. So you'll continue to see us working in this space and helping to build collaborative community around these topics. So we encourage you to, if you're interested in these spaces, to check out the content on our website. A lot of this content is available there, but certainly reach out to us as well with ideas for collaboration that you have or gaps that you see within these spaces that you think a regional coordination entity might be able to help with. We are very strong in supporting faculty and other folks who are really focused on the underlying problems and science there, and really would like to have some help with the outreach and engagement and event management kinds of activities. We're happy to talk about ways that we could help you do that with your interests and your research. And so just to close off, we do hope to see you on a future webinar. We do hold these each month. And so coming up in October, we'll be looking at Midwest collaboration around CI workforce development. There's been a lot of new cyber infrastructure awards made in the Midwest in the past year or two. And so looking at where the gaps remain, particularly around workforce development going forward, that'll be our topic for October. We will look at the NSF cyber training program as one mechanism for supporting that. And then in November, we will be looking at an early career funding program for those who are focused on agriculture through the Foundation for Food and Agriculture Research, which has a fellows program, which is a multi-year mentoring program for early career researchers in ag. And so we'll be planning to have some of those prior fellows join the call and talk about their experience. And so we'd be happy to have folks watching who are interested in that space joining to hear about that as well. So thanks very much for your attention today, and we look forward to talking with you soon.